doesn't?
It doesn't.
So how does it work?
I don't know. I don't need it.
You don't need
It's
it?
for the internet. Yeah, it's for the
You
internet.
guys ready?
And I don't need it.
You ready?
Yeah.
I'd like to welcome everybody here to the San Benito County Board of Supervisors regular meeting for October 7th, 2014. Just a quick announcement. CAO Ray Espinoza is on a personal leave at this time, and we have Ms. Casillas sitting in his place. If you'll stand with me, we'll be led in the Pledge of Allegiance by Supervisor Patello.
Ready, salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Would entertain a motion to acknowledge certificate of posting.
So moved, Mr. Chairman.
All those in favor?
Aye.
Aye. Passes 5-0. We now have a proclamation declaring October 23rd through the 31st as San Benito County Red Ribbon Week. Supervisor Barrios?
Okay, and I'll make a motion to approve the proclamation.
Second?
A motion and a second. All those in favor?
Aye.
Aye. Those opposed? Passes 5-0.
And this proclamation is for Red Ribbon Week, which I understand is happening, there's a run on Sunday.
Saturday.
On Saturday, sorry.
That's
You come
okay.
around this way so you can come out on the camera. So it's my pleasure to present you on behalf of the San Benito County Board of Supervisors in this proclamation, whereas alcohol, tobacco, and drug abuse costs California over $32.1 billion every year and impedes the ability of Californians to lead healthy, productive lives. And whereas it is important for communities, schools, and individuals throughout San Benito County to work together to promote programs and activities which discourage substance abuse. So I won't read the entire proclamation, so therefore, the San Benito County Board of Supervisors does hereby proclaim October 23rd through October 31st, 2014 as Red Ribbon Week in San Benito County. So thank you and good luck with your run.
Thank
We've
you.
had very successful
Thank you.
events.
Thank
And
you.
I believe it's going to be in the city, so if you
It
want to
is.
talk a little bit about it,
Okay.
it would be great.
Say a
And
few
here's the
words.
proclamation. Okay.
Thank you.
Yeah, I'd like to just say a few words, and then I'd like to introduce Renee Hankla, our Substance Abuse Program Manager, who actually does all the planning on this and works with the various groups that get involved. First of all, I think I'm overwhelmed and humbled by the amount of support that we get from the community on this event, both just the community at large, our fellow agencies, law enforcement, probation. They're just instrumental in making this event occur. And a special thank you to Chief Westrick for the Hollister Police Department and his interface with the City of Hollister, where the Red Ribbon Run, the primary event for Red Ribbon Week, will occur this week in downtown Hollister. Also, I want to say that I am also overwhelmed and appreciative of the amount of support and recognition that we're getting, and it's increasingly so, that we're not going to build our way out of this problem by building more prisons. Drug abuse is a huge issue, and prevention and treatment are being recognized as being a major instrumental piece of solving this problem. And with that, I'd like to introduce Renee Hankla. And Renee has a few words to say about the event and some of the people that have been involved in supporting us.
Good morning. This year, we have made a few changes to our Red Ribbon Week events. The first thing is we've brought the run back to Hollister in coordination with the City of Hollister. They're partnering with us to help us. They've been a huge support this year, as well as the Hollister Police Department, and as well as the Sheriff, Probation, the County Office of Education, and Hollister Hills. So we have a lot of partners in this event to make this happen, and I just want to acknowledge them today. And this year we're also having, as well as the run, we're having a kids fun run on Saturday, as well as other kids activities. We're going to raffle off a bicycle for those who participate in the fun run. We're going to have community resource booths, as well as entertainment and music. So I invite all the community to come out and enjoy this event. We're having theme teams this year, so families are coming out as teams to participate in that way. And That will be on Saturday at 9 a.m. at the 400 block on San Benito Street. And this year, we're also having the annual poster contest. We're renaming it as the annual calendar contest because we're going to allow submissions other than artwork created on a poster. We're going to allow digital art, photography, web design, needlework, or other modes of art to include people that maybe don't like to paint or draw, but they have other talents within that mode of art. So we just invite any children in kindergarten through 12th grade to participate, and those submissions are due to us by October 17th, and the grand prize is $100. And then the winners will be featured in our annual calendar that we distribute throughout the community. And again, I'd like to thank the people on our Red Ribbon Committee that included law enforcement as well as community partners, as well as we had a lot of sponsors this year, and I want to recognize some of those. We had about $2,000 worth of sponsors that gave us cash donations, and then we had about $1,500 of in-kind donations this year, which is amazing. It really helps us put on a bigger, better event with that support. We had donations from Earthbound Farms. We had donations from, sorry, there's so many, I can't even remember all of them. Tri-County Carpet Cleaning. Oh gosh, my mind's going blank now. Well, they're on the banners and they're on our website. Sorry. There's so many
Good enough.
details to remember, so I apologize. But this year I also wanted to, I brought a medal to show. It also has the county logo on the back. So this is something different and special this year, so that all the winners will be receiving one of these. And everyone that completes the race will get a finisher medal. So, okay, thank you so much for your time this
Thank you.
morning.
Good luck.
Thank you.
With that, we'll move on to public comment. This is an opportunity to address the board on any item of interest not appearing on the agenda. No action may be taken unless provided by Government Code Section 54954-2, and the speakers will be limited to 3 minutes. Do we have any speaker cards?
Yes, Marvin Jones.
Review session this morning. You remember over the last year and a half, we've had that big Agenda 21, that 1992 Agenda 21 book. They've also got one for locals. It was, you've seen the big map, the biodiversity map, half the United States off limits to humans, about half the other half. Restricted use, you've seen that map. It's coming, just a little bit at a time. I think it was President Bush that signed the law that banned the incandescent light bulbs. Why? Well, it's the environment. We've got to protect the environment, so we cannot have incandescent light bulbs. We import light bulbs from China that are loaded with mercury, but that's okay. That's okay. It was within the last month, Congress has passed a bill, and I assume President Obama will sign it, that bans expanded styrofoam. When the regulations are written, that would probably include everything from what you get your hamburger in, all the way up to the coolers that you take on picnics. So starting next year, expanded styrofoam will be banned because it's not biodegradable. We can't have that. In California, the governor recently signed the law that said that when your great-granddaddy came back from World War II and dug that well, and he's been using his own water for the last 80 years, it's not his anymore. The governor signed a bill that says first of the year, it's the state's, and they're going to put a meter on your private water well. If you've been down I-5 recently and you've seen all of the fallow land, no farming, remember some of the Agenda 21s, no grazing of cattle, no plowing of fields. They're not plowing fields in the San Joaquin Valley because all the water's going to the Delta smelt. It's coming. It's coming. It's coming to San Benito County. We'll be doing some here before long. Thank you.
Marty Richmond. Good morning, Marty Richmond from the city of Hollister. So we've been at this about 3 minutes, and we've been far too nice to each other already. So let me change the tone. I rise here to oppose Measure J, the crusade on Measure J, and why. Why do you think the radicals have targeted San Benito County? We don't have any fracking. We have hardly any wells. We don't generate enough oil to fill a bathtub. Why don't they target Monterey County? I'm going to tell you why. Because if they targeted Monterey County, they would have been told there are hundreds of wells there that have been there for decades, and they don't have any problems. They'd say, show me the contamination. Show me the criminals. Show me all these problems we're going to have. $7.5 million in taxes that Monterey County uses to improve their life. Show me how we're going to replace that. I assure you, and it's really insulting to have the teachers endorse this, I assure you that more young people will die in traffic accidents from the cars out in the parking lot at the high school than will ever be damaged by enhanced oil production. And I assure you that more young adults will die protecting foreign oil sources than will ever be damaged by enhanced oil production. And I assure you that more people will die from the ills of poverty, because poverty is what hurts you, from criminality to gang violence to no health care to poor nutrition to family abuse and all that. That comes from poverty. More people will die from poverty than will ever be harmed by enhanced oil production. So that's all baloney. One might say that Measure J is responsible for those deaths, directly responsible, because they refuse to let people economically move out of poverty. The taxes and wages that will be generated by Measure J could be used for law enforcement, could be used for health care, could be used for education, could be used to take people out of poverty. The entire movement reminds me of the people who opposed fluoridation because it was a communist plot to put fluoride in the water. It doesn't matter what the science says. If they believe it, it must be true. They call this a crusade. And I want to remind you, we have been in history long enough to know that crusades are dangerous, because people who are on crusades check their brains at the door when they get into the tent of the true believers. So I tell you that we should reject Measure J. It's a crusade by people who want to keep the people of Hollister in poverty. Thank you for your time.
Good morning, Chair, Supervisors. My name is Pam Silkwood. I'm here representing Joan and John Sutton, and I'm here to request that a public nuisance action be taken against an illegal auto spraying operation at 300 Swan Court. Almost a year ago, we have spoken with Ray Espinoza and as well as Dr. Wong regarding the illegal spraying, and we have submitted declarations of the residents and visitors who have experienced symptoms upon spraying activities at 300 Swan Court. The Air District had said that there is limitations on spraying regardless of whether it's residential or commercial operation, and that the regulations apply to spraying of less than 2 cars or car parts and 5 gallons of spraying material. And we have submitted photos that clearly show that more than 2 cars are being sprayed per year. My client has been in the emergency room and has received respiratory treatments. We've supplied the medical records, and their sister-in-law, who has both a mental and physical disability, has had experienced cardiac arrest due to the spraying activities on the adjacent property. And again, medical records were provided. We have reports from Dr. Gill, who put in writing that asthma, bronchitis, and pneumatosis occurred due to the spraying activities at 300 Swan Court. We understand that the property owner, Mr. Clayton, and his wife, who is an employee of the county, have ignored these orders and continue their spraying activities, particularly over the weekend when law enforcement and code enforcement officers are not available. More recently, my client has had an LEL monitor device in their home, and the device is intended to measure explosive levels of volatiles, and that meter went off, and it read 12% methane equivalent volatiles. This is 6,000 parts per million of methane equivalent volatiles entering my client's home due to the spraying activities. And the reason is that 300 Swan Court is located in a wind tunnel that the wind goes directly to my client's home, and because of the pressure differentiation, enters the home and fully concentrates the home. The fire department was called. Can you give me one more minute, please? The fire department was called, and due to the fire and explosive concerns, and this is clearly a public nuisance, and the county has failed to respond. All of these documentations were provided to the county health department as well as the CAO's office. Yes, please. I think that it seems like the county is waiting for someone to die or fire or explosion to occur before they do anything. We request that the board direct the staff to open a public nuisance case, and I'm submitting all of these records as part of the administrative record. Thank you.
John Sutton.
Hi, my name is John Sutton. Thanks for the time, listening. We're a family. There was 4 of us, and now there's 3 of us. My son, went to college and moved away. We live in our home, and we try and live in our home peacefully. And we have a problem with the chemicals that come into our home. It makes us sick. I've experienced symptoms. My sister-in-law has experienced symptoms. My wife doesn't experience much because she's not here much. She works, and she works up in Los Gatos, which is, she spends 12 to 15 hours a day away. And so Judy and I are the main ones in our home that are taking a health hit. And we're a family that's, and because of the situation, we're a family, we've spent a lot of money at the hospital, in the ER, and we've talked to a lot of people, and we tried to talk to people where we could solve the problem because we thought it would be an easy problem to solve. And it appears at this point that my neighbor, Mr. Clayton, has more right to spray his cars and make us sick than get a spray booth or get some control of the fumes. Last night at approximately 6:30, he was spraying the top of a 55 Chevy out in the open air, and the fumes were again blowing in the direction of my house. I live south of the Claytons. And one of the reports written from his name's Victor from Environmental Health, he said that our house suffers from a wind tunnel effect. And it's in his report, and the wind goes directly into my house. I had a havoc specialist come from LA who's helping me trying to clean the air in my house, and he tested my house, and my house, because of the design of my house and the wind flow, because we have wind in Hollister, I have a negative atmosphere in my house. So my house is like a vacuum cleaner. So when he sprays, I'm usually at 0.3 to 1.3. And if I turn on an exhaust fan, a fan over my stove, it just goes up. I'm more negative, and it sucks in more fumes. I've talked to Mr. Clayton. I tried to work this out with him, but it doesn't seem to be any kind of resolution. I've talked to people in the county, in the health department. I've talked to people in the fire department. And nobody seems to have, any help to prevent us from being injured. We've been injured. And now my neighbor next door has 3 kids. One's 4 months, one's 3 years, and the other's his kids. They open the windows at night, and the fumes come in, for his kids. He's at 360, which is just next door to mine. So he's got the same deal. So my neighbor across the way, she moves her horses when she sees he has put flags up on his property, and when the wind blows towards her property, she takes her horses, can I finish? Just 30 seconds, and she moves her horses to the back of her property to get her animals away from the spraying, because it goes across the street and it goes into her pastures. So there's a reason why we have spray booths downtown. They work. Bare minimum, we need to get a spray booth.
Mr. Chairman, just a clarification of your address. I just want to know what your address is.
342 Cowden.
Okay, thank you.
Thank you.
Would anyone else like to address the board on any item not on the agenda? Seeing none, we'll move on to department heads. Ms. Casillas?
Okay, a couple of items before we begin with department head announcements. We have a few changes to the agenda this morning. We are going to pull or continue item 17 due to Mr. Espinoza's absence today. And I believe we can continue that to the next meeting of October 21st. And then we are going to also pull item number 13, Clerk, Auditor, Recorder, Joe Paul Gonzalez asked that we continue that item. I think we can continue that item to the 21st. He felt that it was important for Mr. Espinoza to also be here for any discussions related to that item. And then we are also going to pull number 8. Mr. Ridingworth asked us to pull item number 8. I'm sorry.
17 and 13.
17, 13, and number 8. Any more that you know?
Say 18. Said 8, right?
8, 13, and 17. Okay, and we have 2 department head announcements this morning. The first is with Assistant Clerk Recorder Angela Curro. I believe she has some information regarding the upcoming November elections.
Good morning. I have placed a little step-by-step that I'm going to go through at the back, so if anyone wants a copy, feel free. Basically, this is just a heads up of what's happening on the election. The initial mailing of the state pamphlet was completed by the Secretary of State's office, and those are by household, so those will be received over the next few days. If you haven't received one, you can contact our office and we can do an additional mailing, but please keep a lookout in your mail for that. That sample, or that pamphlet, contains Proposition 2, Proposition 45 through 48. Prop 49 was pulled by the state. Additionally, there's a supplemental mailing from the state which contains Proposition 1. That will be out in the next few days if you haven't already received it. The county sample ballot was delivered to the San Jose Post Office yesterday. They will be hitting the Hollister Post Office today. They will be delivered over the next several days. It will take the post office about 4 to 7 days to get all those delivered. Additionally, the vote-by-mail ballots were dropped at the post office yesterday in San Jose. Those also will be received. There's almost 18,000 voters that are voting by mail this election, so please keep that in mind. Also, it's a 2-card ballot. It's 70 cents to return if you are a vote by mail. There is no charge if you are a mail ballot precinct, which means you don't have a polling place. So please make note of that. Highlights for this election: we've had an increase of about 30% of the contests that normally appear on the ballot have increased by 30% due to the increase in candidates. The majority of this is due to special districts. So what that's done is it's caused us to have more ballot types this election than usual, which means there's more variations of the ballot, which has increased the number of polling places. So there have been polling place changes, and we sent a preliminary letter out to all voters that have changed either their polling place from the primary to the general, or were at a polling place and now are at a vote by mail, or they're a mail ballot precinct. We're telling everyone, please make note on the back of your sample ballot as to the change of your polling place, okay?
Angela,
Yes.
Mr. Chairman, On the old polling places, is it possible to have a little map where the new polling place is?
We're going to
or-
do some signage at the old polling places, and we actually are also doing some outreach with the communities where they're happening, where it's occurring. We're posting signs at, like, the tennis court. One of the changes was Ridgemark is normally at the tennis court. Because of it consolidating with voters in the Sunny Slope Water District, we've moved it to the main clubhouse. So we'll have signs posted there at both the clubhouse and at the tennis court. And that'll happen in other areas of the community where these changes have occurred. Let's see, early voting started yesterday, if you can believe it already. So voting in our office is 9 to noon and 1 to 4. Also, we will have weekend voting the weekend prior to the election. If voters would like to come and vote in person early, they can vote Saturday and Sunday, the 1st and the 2nd, and that'll be from 9 a.m. to 3 p.m. Also, another change, now that the courts have left the Hall of Records or the old courthouse, we are relocating election night ballot counting to the downstairs main courtroom. That will allow us to have 2 card readers running, so it will also accommodate for more observers. Lastly, as usual, we want to thank all of our volunteers that work Election Day. Without our poll workers, we would literally not be able to do the job that we do. With the increase in polling places, we are requesting anyone that's interested in being a poll worker to contact Francisco Diaz at my office, and I've noted the number on my handout. And that's all I have. Thank you so much for your time.
Angela, oh, I'm
I was
sorry.
going to say, before you sit down, I was going to make sure there was no other questions. Apparently there are.
There are.
Okay.
I just wanted you to publicly say the number so that people that are watching this can
Oh,
actually
sure.
jot it down
Sure,
in case they
for
don't.
election officers, it's 831-636-4016. Okay?
Thank you, Mr. Chairman.
Thank you.
Any other questions? Thank you, Angela.
We have another department head announcement from Director of Health and Human Services, James Ridingsworth, and he's going to provide some updates on CSWD under his direction.
Good morning. First, I'd like to announce that on October the 15th, we're going to be conducting the first, I think in the state, live televised virtual job fair. And we're passing out a flyer for you to have. I'll leave some in the back after we finish here. We have, at this point in time, 25 employers. And this is a place that, and it's going to be televised on CMAP TV. And it's an opportunity for people who want to connect up with employers to, hear directly from them what they need and who they're looking for. And we are excited and encouraging people to be involved in that. Second, staying with the theme of employment, we do have a subsidized employment program. Last year, it was smaller. This year, it's going to get larger. But based on what happened last year, we now have 9 families or individuals who are in subsidized employment in various places in the county. We hope to expand that to close to 40 for this next year. Out of those 9 that are currently in subsidized employment, 3 of those families have moved on to permanent employment. And then on September the 28th, we had a lunch in the park where we invited the homeless community to show up. The purpose of the lunch was to conduct what are called vulnerability index surveys. We are very encouraged that we had 25 participants show up, and we completed 24 surveys. These surveys will help us to begin to build a data bank that can help guide your decisions regarding homeless services in San Benito County. Thank you very much.
Any questions? Okay. Thank you, Jim.
And those are all the department head
Okay.
announcements.
With that, we'll move on to board announcements. Supervisor Patello.
Nothing today, thank you.
Supervisor Barrios?
Thank you, Mr. Chair. I want to commend the staff from Health and Human Services and Jim for putting on that luncheon for the homeless population. It was very successful. Those surveys are going to serve us well in gathering the data to provide better services. The mayor and I were there, and we walked the river, actually, to see what the homeless community looked like down there. And I have to tell you that we are moving in the right direction by doing what we're doing and being proactive. That is a growing community. There are makeshift homes over there. They cook there. Their garbage is there. It is really something to see. And so I'm glad that we're addressing it, and I'm glad that we're being proactive in regards to that. I attended the intergovernmental meeting, and I would like to add to a future agenda a landscape ordinance. I know that the city of Hollister has one, and that is to preserve for water conservation. And the city has been very proactive in getting one already in place, and I think the county should do the same thing. And that is to, for new development, to be able to put in landscaping that would conserve water. So if we can do that, I think that would be a really smart move on our part.
Yeah, I absolutely agree. And so it was brought to my attention by Sean Novak that it's possible. I know that we're going to meet about regarding the graywater ordinance, and maybe in addition to the graywater ordinance, we could talk about the landscape ordinance as well, mixed with that, because they kind of go hand in hand.
That's an idea for that committee to look at that.
Okay, that would be fine, but we do need to address that if we can as soon as possible. We also talked at intergovernmental about CBOs, our community-based organizations that we budget money and give to them, and we talked about what is the city doing, which direction are they taking, because we have committed to a committee that is going to have representatives from the county and staff. And so we got very positive response. They do want to be on board. They don't really have a plan as we do as far as application process, and so they are willing to step up to that and go in that direction with the county. So if you could communicate with them, they will talk to their city council to have 2 members be on that committee.
Okay.
And they will look at the direction that they take on the application process and possibly use that committee to provide them direction on how to provide money to the CBOs.
Okay.
And the last thing on the intergovernmental is that we had a presentation by Richard Rosales from Caltrans in regards to Highway 25. Made it very clear that Highway 25 is not a priority for the state of California. We're kind of on our own as to what we're going to do, which leads me to ask, what are we doing? I know that this board gave direction to COG to make sure that Highway 25 is on the constraint list. We need to make sure that that is happening. If it isn't, then we need to move and figure out why it isn't happening, because it is going to affect our general plan. And I know that we have a timeline, and it was reported by Byron that we are on that timeline. But if our consultant has not received the information on Highway 25, this may mean more cost to the county and more time. So I just need to make sure that that we are doing the right thing by that resolution that is supposed to put Highway 25 on the constraint list. So that is it. Thank you, Mr. Chair.
Yeah, and certainly the chairman and I are on the COG, and it is a high priority. Highway 25 is a priority of discussion, and we're going to, finish the environmental work that had begun, and we allocated funds several meetings ago to finish that. And so that is one of the steps that is needed to place Highway 25 on the constrained list. So that also extends the timeline in which we could work on our project. And what we need to do is work with Caltrans on the design of the Highway 25 widening. The current design that was proposed, several years back is just not affordable. and we need to try to work with Caltrans, work with City of Hollister and the county to evaluate, see what we could do to redesign the project. And also, what's a key component, which I think in a month or so, we're supposed to have a retreat, a workshop, so to speak, just primarily for the Highway 25. How are we going to pay for it? You know, in order to put it on the constrained list, you have to have identified funds to pay for this, whether it's going to be a sales, county-wide sales tax. You know, a toll road is not, people aren't too enthused about that idea, but we're go over some ideas because it's not just be impact fees that's be able to carry the entire cost of this widening project. And the other part of that is also maybe phasing in the project. You know, we're not do the whole Highway 25 in one grand project. It's be a phased-in project over a number of years. And so there's a lot of detail and issues to work through. We understand that the City of Hollister is very anxious to just pass a piece of paper and say it's on the constrained list. Well, things don't work like that. And but we're try to work together as a you know a group, develop a plan that makes sense, and go forward. I think I got it covered, Mr. Chairman.
I think that's pretty well covered. So COG is definitely working on it, and we want to do it right and identify the funding source, because the impact fees cannot pay for the whole thing. We've been told over and over. So some other funding source to fund the deficit of the highway now has to be identified. So COG is definitely working on it.
All right, and I think my biggest concern is to make sure that it doesn't hold up our general plan process, and that would be my,
Yeah, and you're absolutely correct. We do not want it to hold up the general plan. We want the general plan done by the end of the year.
Okay.
And it does, from what we've been told, the general plan can go forward as we
Okay.
go, as COG goes forward with the plan for Highway 25.
okay, very good, thank you.
Thank you. Supervisor Rivas? Supervisor Dela Cruz?
Thank you, Mr. Chair. I too had on my list to bring up Highway 25 from COG. Thank you, Supervisor Batalo. I do want to see, you know, update when you come back to the board. Give us an update on it, and if you need the necessary, use our facility to educate, you know, those who are not members of COG on what's going on with 25. Because I do remember this body did agree to you know, move forward on putting 25 back on the constraint list, and now I'm beginning to hear nothing but roadblocks are on the way now. So I'd like to see it come back, give reports to the board to ensure that maybe we can assist you on whatever roadblocks are in the way.
Thank you. I'd like to report out that I had the pleasure of attending the Rural County Representatives of California annual convention. It was actually a couple of weeks ago. We left, the CAO, Ray Espinoza, and myself left right after our last board meeting. And they had a lot of great seminars. I think one of the most interesting one was entitled Marijuana in Colorado 1 year later. And they were talking about how Colorado has legalized recreational marijuana and the issues they have been going over. And one of the presenters said it was like an onion. Every time you peel back a layer, you start to cry. So, but
Like that.
it was a very good convention, being able to hear what other supervisors, their issues in the rural counties, and it was great to be able to attend that. I also want to thank the 33rd Ag District Board for another great fair. It was a little warm. I have here probably the hottest item, pun intended, and it was this little fan that our beloved Monterey Bay Unified Air Pollution Control District was handing out. It was the most seen thing that everybody was using to keep themselves cool. It emitted no emissions, no pollution, but kept everybody cool. And then I also would like to ask staff, and I've been talking to staff already, I'm not sure if the rest of the board is aware, but there's an issue up in the Ridgemark community. The owners of the golf course are removing trees, and apparently they're removing both live and diseased trees along with perfectly healthy trees. And I've asked and I've worked with staff looking at our tree ordinance. We do not have much of a tree ordinance, so I think we need to probably look at our ordinance on trees. Many communities, many counties do have an ordinance on removing trees, and I think we need to look at ours a little bit closer and explore that a little bit more. Okay, with that, we'll move on to our consent agenda. I've been asked to pull items 3 and 9, and of course, we are continuing item 8. Is there any other items that the board would like to pull? Okay.
Would like to pull items 1 and 4.
1 and 4 has been asked by the member of the public. Is there anybody in the public that would like to pull any other items on our consent agenda at this time? Seeing none, what's the pleasure of the board?
Move to approve with the items that are pulled, left out.
Second.
We have a motion and a second. All those in favor?
Aye.
Aye.
Aye. Those opposed? Passes 5-0. Item number 1.
Rebecca Jones. Which item number 3?
No, we're doing item 1, which is yours also, Alan.
Hi.
Good morning, everyone. My name's Rebecca Jones. I'm the director of the emergency department at our local hospital. I've been asked by hospital administration and our new ED medical director, Dr. William Benda, to respectfully request that the recommended actions noted under number 11 of this item be delayed because of deficiencies from the behavioral health department in developing the community program plan. The deficiency is that all relevant stakeholders were not included. The Mental Health Services Act Oversight and Accountability Commission provides instructions for county mental health programs to prepare and submit a Mental Health Services Act 3-year program. Part of the instructions from Welfare and Institution Code 5848 identifies the stakeholders. The list included law enforcement, social services agencies, and healthcare organizations. Hazel Hawkins Hospital is a healthcare organization. If the hospital had been included, deficiencies with the current system of placing patients in need of inpatient psychiatric care would have been identified. The Behavioral Health Department is fully aware of the current delays in treatment due to the lack of adequate transportation from the emergency department to an inpatient facility. Hazel Hawkins Hospital is not a licensed psychiatric facility. Just this past weekend, Friday afternoon, a patient arrived. He was medically cleared. After 30 hours, placement was found. Monday afternoon, he was still there after 72 hours because he could not get there was no transportation to get to the inpatient facility. This patient received no psychiatric care at all and was sent home with other resources. There have been at least 4 other occasions in the last 6 weeks where a patient was in the ED waiting for placement to a psychiatric facility. Several times placement was found, only to have the 72-hour hold expire because of lack of transportation. One patient who was deemed 5150 danger to others had their 5150 removed. The patient was released to a family member who on more than one occasion had been threatened by the person placed on the 5150 hold. Recently, Judge Sanders gave a court order for a patient to be taken to the ED and, if deemed 5150, be transferred to a psychiatric facility. This is an example of a huge lack of understanding of how this system actually works. If a patient's brought to the emergency department and placed on a 5150 hold, they need to be medically cleared by the emergency room doctor. When they are, the mental health crisis worker is called and evaluated. This can take several hours. The crisis worker will decide if the patient is released or if they need to be placed in an inpatient facility. The crisis worker often leaves the department to search for placement from a remote location. There's no record of calls placed on behalf of this patient. Frequently, there is no update from the crisis worker unless the ED calls. The patient can be sitting in the ED from 12, 24, 36, up to 72 hours. Some of these patients are very violent and aggressive and very disrupted, which affects how the doctors and nurses treat the other sick patients in the hospital. Our psych room is room 1. Room 2 cannot be used because of disruption of some of these patients. Some of these patients have gone to the restroom and spread pee and poo all over the wall of the public restroom. To mitigate that, we placed a bedside commode in the room, which they pee and poo in and place the styrofoam from their meals, towels, utensils, telephone into the commode. All of this must be separated. We know to only give 1 water bottle at a time. If I could just have one more moment, please. We know to only give 1 water bottle at a time and remove the empty water bottle because patients have peed in the empty water bottle and used it against the staff. We are not a licensed psychiatric facility. Patients on a 5150 hold require security guard for continuous observation just so they don't hurt themselves. There was a caged car available for this special circumstance of Judge Sanders. I believe all patients in need of psychiatric care are special and should be able to get to their facility. There is no contract for any type of transportation between the mental health department and any agency. Neither is there for the hospital. This transportation process is left to the emergency department to figure out. This agenda item provides a review of the community program planning and local review process, and it indicates that the requirements per Title IX of the CCR Section 3300 and 3015, these were not met. As noted in number 1, page 11 and 12, planning process has been comprehensive and included input of diverse stakeholders. That is not true. With this information, the unique needs of our community were determined. These unique needs have not been completely addressed.
If you can summarize now.
Hazel Hawkins recognizes that the 30-day public comment period ended 9/17 and that the date of the public hearing has passed. But we should have been included in the initial development of the Mental Health Service Act. We respectfully ask that this budgeted item be reevaluated so to include a process for the patient to actually get from point A to point B. Thank you.
Well, I guess first of all, there's 2 sides to every story. The Mental Health Service Act does not cover involuntary care, so the issue of 72-hour holds is a not-included service related to the Mental Health Service Act. In fact, the Mental Health Service Act was intended to prevent involuntary care and inpatient utilization and use the least restrictive settings. In terms of the public input period, public input was allowed. We collected over 600 surveys for input. The Mental Health Service Act plan itself was posted both on the internet and in hard copy. Hard copies were left at Hazel Hawkins Hospital and various other public areas. And the 30-day public comment period was held. Clear addresses on how to contact us and provide that input were provided publicly, both in the newspaper and on the internet. And we held a public hearing that was concluded as a part of that public input process. It was held in coincidence with the Behavioral Health Board. No attendees from the public attended. It was publicized, so there's plenty of opportunity to give input. So with that said, I believe the Mental Health Service Act statutes were followed. There was adequate allowance for anybody to provide input that needed to provide input. The issue of involuntary care and transportation for clients that are put on 5150 is a separate and distinct issue, and it gets much more complex than I can explain here. It relates to EMTALA, the patient anti-dumping law. So in fact, when a patient is admitted to the Hazel Hawkins emergency room, if you and I were found wandering on the street confused, you cannot assume that we have a mental illness. I know oftentimes people brought into the emergency room are told that they are mental health clients. Some of those people are never enrolled in service. I would be very concerned if somebody that had a serious medical disorder that put them in a state of being disoriented, never hit the medical floor, and never got a medical clearance. That is why patients are admitted to the emergency room. Once they're admitted there, they receive a medical clearance. When the medical clearance is finished, and if they still meet the 5150 hold criteria, we do our best to arrange for a hospital for psychiatric inpatient care. The actual ambulance contract is not held by us. It's my understanding it's held by the hospital, and the hospital, due to EMTALA, has the full responsibility for the transportation to an appropriate facility. That being said, we recognize we are partners with the hospital, and we try to cooperate in any manner that we can with them. If there is an undue delay due to the ambulance company not responding in a timely manner, there are times when a client no longer meets a 72-hour hold criteria because they cleared during that period of time. They are oftentimes under the influence of substance abuse, and the drugs or alcohol no longer put them in an intoxicated state, and we have to release the hold.
Supervisor Barrios?
Thank you, Mr. Chair. Alan, is this then an issue that we should be discussing with our ambulance contractor? Because you're saying that a lot of times that is the weakness.
It is an issue that we should discuss with the ambulance contractor, and my understanding that is AMR. We do not have a contract with AMR. AMR informed me that they have a hospital contract, a transportation contract with the hospital. I know that you have on agenda today a contract for the county with AMR. It's my understanding that's for another purpose other than transportation out of Hazel Hawkins' emergency room. And I understand that because Hazel Hawkins, once they admit somebody to their emergency room, that is their client. So the hospital responsibility should rely between the agreement between the hospital and the ambulance provider. That being said, I can tell you that I read an article earlier this week, in fact, regarding Santa Clara County and their ambulance contractor, and they've had a problem with timeliness and other issues, and they want to create some sort of a clause in the contract around timely response. If I was the holder of the contract, I would suggest that we do that. I am not the holder of that contract. I would suggest that the hospital approach something like that. I have talked with AMR about what that particular problem is, even though I am not the contractor. The issue is a small county issue, and they have told me that because of economics, they can no longer afford to put as many units out here as they had previously, units on standby. So it's my understanding they put 2 units out here. They cannot put more units out here. They also prioritize how those units are utilized in terms of provision of life support transportation versus what is deemed to be our client who is in a non-life-threatening crisis situation. So that's another factor. So it's a complex issue.
Yeah, it is complex, and may I still have the floor, Mr. Chair? Thank you. What do we need to do, or is it possible for behavioral health to contract with the ambulance service?
Well, it absolutely is possible for us to contract with the ambulance service, and we had previously, in previous years, contracted with them. We had virtually received no billing from the ambulance company because most of the clients that were involved with us are Medi-Cal clients, and Medi-Cal is supposed to be deemed to be payment in full. The other part of that, in that discussion, we raised the question, well, isn't the primary utilizer of ambulance use Hazel Hawkins Hospital? They said yes. And we raised the issue of EMTALA and the responsibility to transfer to another care provider if the hospital does not provide that type of care. They agreed with that and said that they would approach Hazel Hawkins Hospital about that. We talked with Hazel Hawkins Hospital. They agreed that they would be the contract holder, we would not. And that made sense to us because we have virtually received no billing.
Okay. All right. Thank you. Thank you, Mr. Chair.
I guess Jaime had it up.
Supervisor De La Cruz?
Thank you. Thank you, Mr. Chair. Thank you, Supervisor Batal. Alan, I have heard, no, I'm sorry, I apologize. I have had families come to my house and share with me their experience on potential 5150s. 13, 14, 15-year-old kids, and how frustrated they are with your department about how to classify them and how to provide assistance to them. bedding, transportation, medical services, counseling, and I know that costs money, and I know there's going to be some justification on your part, but it's out there. It's out there in the community that somehow the county just doesn't provide these services, and I've seen it firsthand where members of our community have to go somewhere else, which they can't even afford. Sometimes it bankrupts these families because of the 5150 potential. What can we and you helping us out work together to reach out to the families when the time comes?
Well, let me be clear that I understand the problem that you're presenting, that families have family members that they believe should be hospitalized.
Well, it's more than hospitalized. They're already going through the whole process.
Yeah. Well, we have basically two levels of care, outpatient and inpatient, and virtually all inpatient care is involuntary. When we get into involuntary care, it's the issue of whether they meet the 5150 criteria. And this becomes a serious issue of discussion across the nation on this issue of civil liberties of the individual versus meeting the issue of involuntary confinement. I can tell you that most individuals do not want to be told, you're not going home for 72 hours.
Yeah, but after 72 hours, they're free to go.
After 72 hours, they are free to go.
Yeah, but we're talking about minors. I mean, that's where my heart's at.
Well, let me give you an example of a call, and I think this is what prompted this discussion today. I received a call on Sunday evening, 2 weekends ago, because an emergency room doctor could not get an ambulance to respond in a timely manner regarding a 14-year-old that was put on a 5150 hold. Somebody in that household, an adult, provided that 14-year-old with alcohol. She became intoxicated, became belligerent, and threatening towards one of the other adults. Police were called. Police interrupted the situation by writing a 5150, brought the child, the 14-year-old, to the emergency room. We sustained the 5150. We found a hospital that would take the person. The ambulance company could not respond in a timely manner.
In which hospital did you?
This was Fremont Hospital. And keep in mind, there are very few hospitals any longer
Because you
that
have a
provide
contract
care
down
for
here.
minors.
You have a contract, excuse me, you have a contract that's down here that actually either Marge or Anthony or somebody pull it, and I think I pulled it out, with a continual contract with Nativ Medical Center to provide
Natividad only will house adults on inpatient.
non-patients. And so there's no, for minors, 5150 except Fremont Hospital.
No, there are a few others. And keep in mind, this is across all of California. I talked to my colleagues. For example, Lassen County will have transportation of minors all the way down to Vallejo on a 5150 because that's where the Children's Hospital is at. This is something that we all go through as the mental health county plan.
And I guess,
So-
and I guess I'll just say right now, there's no other process how to seek benefits for a 5150 minor, right? Everybody goes to the same boat, right? You don't have a criteria for, well, okay, we will go let this person go through a 5150. We will provide the services, and this other person we just determine is just not ready for funding for 5150. You don't have any of those type of matrix. It's all black and white. It's all in a binder that everybody gets treated the same.
No, quite the contrary. If they don't meet 5150 criteria, they always have a crisis plan put in place, and we try to make an immediate appointment with them for outpatient services as soon as possible. And sometimes they're put on one of the Mental Health Service Act programs called the Full Service Partnership, which is an intensive wraparound service for the very idea of preventing inpatient involuntary care. That doesn't mean that these clients will accept that care voluntarily, though. And that's what I mean. Many clients will come to the ER. Oftentimes, they're chronic substance abuse clients. They're not our clients. They're chronic substance abusers in the community. They don't want to interrupt that cycle. And they get in situations in the community, and law enforcement intervenes. They're put on a 5150. There's temporary organicity due to that intoxication. They're not functioning well, and they clear. And the next day, they're fine, and they don't want our service.
Thank you, Ellen.
Supervisor Botello?
Yeah, I've bumped into a few 5150s in my time, but I think what concerns me from the presentation from, the person that pulled the item was that they weren't part of this 3-year plan that is up for approval today. And I just wonder if their scope of their concern is narrowed to transportation from a non-care facility for psychiatric needs to a facility that can provide those needs, and the delay. Is this something that maybe we should just put a hold on and have a meeting with the hospital district? It's one thing about the public and their input, but we're talking about an agency that we should be working in close partnerships with. And if there's some way we could resolve this issue. If there isn't, there isn't. But maybe it's something that we should, take a little bit more time and at least have another opportunity for the hospital district to add input and ideas to this 3-year plan, and see if we could resolve this very, I think, specific problem.
Well, a couple of thoughts on that. First of all, I 100% agree with you that we have shared clients, and that's the way I view it. So I certainly don't view it as, geez, you have taller responsibilities and it's your problem. I see it as a partnership, and it's a resource that we very much need. The Mental Health Service Act will not affect the transportation piece regarding involuntary clients, so I want to be clear about that. The Mental Health Service Act does not cover involuntary care. I see this as a separate and distinct discussion about transportation. When I received the call that I was giving the example of Sunday evening two weekends ago, that triggered a series of other events. Dr. Sharma eventually contacted me, as did the public health officer from Public Health, because it triggered a number of calls throughout the community. I spoke with Dr. Sharma about the issue. She referred me back to Dr. Malcolm. He's the emergency room supervising doctor, inviting him to talk with me, and I extended the invitation for him to talk with me. I have not heard from them yet. So I agree, more discussion about this issue of transportation is warranted. I can tell you that the Mental Health Service Act will not cover transportation related to involuntary care, two separate and distinct issues. Now, if the hospital would like to give more input related to the Mental Health Service Act, again, I want to underscore that there was ample opportunity, and we met the statutes of the regulation in allowing that ample opportunity for input. But I have no problem if they want to give me some input relevant to the Mental Health Service Act services. No problem with that at all. So if you'd like to extend the period of time for that to occur, no problem. But it will not touch the issue of ambulance transportation because it's not included in the Act.
I would feel a little bit more comfortable if we extended a period of time of a month to, allow, make sure that the Hazel Hawkins Hospital District has had their opportunity, and perhaps, maybe in those meetings, a discussion could take place as far as how we could try to work together to resolve this transportation issue, because it not only is it affects the mental health 5150 person that obligated for the care, but also the quality and experience of other patients in the hospital. So I'd like to see this addressed. But I think we need to allow an added period of time for our hospital district work with, Alan Yamamoto on this.
And I too concur. And if this is not time sensitive, and I hope it isn't, I would concur with Supervisor Patello that we need to give this another month. Couple comments. It seems like we have a lot of these medical issues that were pulled. I want to maybe chastise staff a little bit. We have to work with the hospital district. We have to get their input on these kind of things. And on the other hand, I want to chastise the hospital district too a little bit. Make sure, if you've been given notice that something's coming up, that you get your comments put in. But we definitely have to work with the hospital district and hear from them on these issues. With that, I open this up to anybody else from the public that would like to comment on this item before the board.
I would just like to add one more thing for clarification. When you mentioned time sensitivity, I'm not saying this because I'm not in agreement with your idea, because I am in agreement with your idea 100%. I see us as partners. There's an Oversight and Accountability Commission appointed by the governor that has to approve a component of this plan. They only meet during certain periods of time. We were trying to trigger the approval of this plan to meet their next meeting, so there will be a delay in that sense. Will that have any material effect on money coming to us? No, I'm not concerned about that, but it's just something so you're fully informed of any delays that will be part of that.
Is a month's time too much, or you think, or is it appropriate? I just pulled that out of.
Well, they probably will not meet again if we don't get this in for their next meeting for some time well over 1 month. So it would allow us actually more time, but it pushes out the delay for the approval and the funding cycle on this a little further. That being said, we have adequate funds. That's not an issue. So I don't have a problem with the delay. Again, the delay of this will not have any effect on what I think the true discussion issue that we need to have with the hospital is, and that's about ambulance transportation. Because my sense is that that call triggered a firestorm of issues around the frustration about the ambulance provider. So I really think that frustration should be directed towards the ambulance provider, not towards mental health, not towards the hospital. There needs to be a clause in there about timeliness. And again, I will re-reference Santa Clara County has the same issue, and they're going to approach a new contract with potentially another provider in 2 years when their ambulance contract is up. So it's not just a small county issue. It's not just provider distinct. It's probably an economic issue about how much ambulance outstationing can take place in a community.
Right. You know, I just don't want, you know, it be said that our hospital district could go to an Oversight Accountability Commission meeting and then have the opportunity, you know, I just don't want that argument. And so I'm still okay with the delay personally.
Yeah.
I think somebody from the audience.
Gordon, come on up.
I'm here today to talk on item number 9, which is AMR's contract, which is related to this, so I don't know where.
Oh, is it more, are you here, do you want to address this item?
Well, what you're discussing today is ambulance transportation is what the problem is, you know. First of all, I'd like to defend Hazel Hawkins in the sense that, not on this particular contract, but there seemed to be a lack of communication, no question about it, that on number 9, which I don't know if it's appropriate to talk about, we had no notification, and we're directly related to ambulances. This is where they go probably 99% of the time. I think we should have been notified or something. We found it on the web, the agenda on the web, and that's why we're here today, or I'm here today on that number 9. But in regards to that, what we're talking about in the transportation, well, you know, I really feel it's inappropriate for me talking about your contract at number 9 at this time. Is that all right?
If you're going to, you probably should wait till, if you're going to address the contract with AMR, you probably should wait till 9. Okay. All right.
Hi, Marty Richmond from Hollister again. And I'm getting older and need more medical care. So I thought I'd address that. I'm sure when Supervisor Vitello reviews the tape, he'll see that he said it's not like somebody from the public coming in. It's actually an organization. Well, I think the public input's important. You may
I
not
didn't
think
say it
that's
wasn't.
what you said.
Well,
You
however
review the
want to
tape, I'm
interpret
sure
it.
you will. Here's my take. First of all, I'd like to thank Dr. Yamamoto and the people at Hazel Hawkins, because like he said, he gets a call on Sunday while we're all watching football. He's working. And the people at Hazel Hawkins, especially in the emergency room, and that emergency room doctor who's got the problem, he's working. and the emergency room people, they're all working. So they're working around the clock. And they got a problem because some idiot at the state or the federal level didn't think about what you have to do when you transport somebody. And since most people don't have a psychiatric hospital, and even those who do don't take children, you have to transport these folks. And they forgot to put that in the Mental Health Service Act, and they forgot to put that in somebody else's responsibility. So we should just erase the lines between the folks at the mental health and the hospital and give them the authority and the money to work it out. Now, I know the money's going to be a problem because we are a poor county and we can't miss an opportunity to pass up any revenue we might get from either our people transporting themselves or wherever. And so since we don't have the revenue, our residents have to suffer. They have to sit there on a 72-hour hold. They have to tie up 2 rooms in the emergency room, which the people of this county paid a fortune to put up, and they have to disturb the entire operation of the emergency room, people who need emergency health care, because we don't have the money to work this out. So I think what you ought to do is give them the authority and the funding they need to get the transportation issue solved. With respect to Dr. Yamamoto, I do respect him. His comment, Santa Clara County is going to work on it. Santa Clara County is going to bring millions of dollars to the table to work on it. And we don't have those millions of dollars to work on it. And that's going to be a big difference. But you know, we decided we don't need it. We'd rather stay in the backwater. With people living longer, there's going to be more problems. Alzheimer's is a big problem, and a lot of people. And many Alzheimer patients, I will wrap up. I'm not a doctor, but I know many Alzheimer's patients get violent. So that's going to be a problem. And you're looking at the future. We need to solve it. Thank you for your time, and thank you for your service.
Is there anyone else from the public that'd like to address this item at this time? Seeing none, I would entertain a motion to continue this to a date certain of November 4th.
Mr. Chair, before you do that, I'm sorry. I just have to say that I don't believe that we need to hold this up. The issues are unrelated to the MHSA, totally unrelated. These are isolated issues that are more contractual. I sit on the Behavioral Health Board. I was at the public hearing. Nobody showed up. We did give people plenty of opportunity to make comments, to have input. It's unrelated. I'm sorry, so I will not support holding this up. There's no reason to. So, thank you.
And I'll make a motion that we continue the item to November 4th, just out of concern of the first speaker's comments that, you know, they would have liked to have had a little bit more opportunity for input. I do, you know, not necessarily disagree that, you know, there was opportunity, but I would just feel so much more comfortable, especially if we are under no time restrictions or risk of funding to do so. So my motion is to continue the item to November 4th, you said?
Yeah.
To November 4th.
And I will second that item. Okay, all those in favor?
Aye.
Aye. Those opposed?
No?
No.
Okay, so it fails 3-2.
No, it passed.
No, I'm sorry, you said, I'm sorry, it passes 3-2.
Thank you.
So we will continue this to the 4th.
Thank you. Was there another item of mine? Was there another item of mine?
Yeah, I think number 3 was also pulled.
Okay.
I can most likely, if the hospital meets with Alan, we can address this. We just need some clarification on what happens when it is a child, because as Alan noted, Natividad only takes adults. So I'll waive speaking on this in anticipation we can discuss.
So, let me just ask, for clarification, are you okay with us approving this item now, and then you'll discuss your concerns with them when you meet?
Yes, sir. Thanks for
Okay.
asking.
All right, thank you for that. Anybody else from the public like to address this item? Seeing none, what's the pleasure of the board?
I will make a motion to approve the contract with renewal with Natividad Medical Center.
Second.
We have a motion and a second. All those in favor?
Aye.
Aye. Those opposed? Passes 5-0. Move on to item number 4.
Rebecca Jones, number 4. I'll withdraw that at this time.
Okay. Since it was pulled, I'll give the members of the public an opportunity to address this item. Seeing none, what's the pleasure of the board?
Move to approve.
Second?
We have a motion and a second. All those in favor?
Aye.
Aye. Those opposed? Passes 5-0. We'll move on to item number 9.
Gordon Machado?
Thank you, and good morning. Again, our concern with the contract, as I said earlier, we had no knowledge of its adoption today, other than looking at the internet yesterday. The concern with AMR is not necessarily, or not at all, really, with the 911, the emergency part of it. Our concern, again, is what spoke earlier, is the idea of transfer for non-emergencies. And some of that non-emergencies is not probably the true classification. If he had a hemophiliac, a bleeder, that had to go to a different hospital for a higher or level of care or specialty, the ambulances don't like to take them because it's not a 911 call. But somebody has to transport those people to those other hospitals with the ability to react if there is a problem during the transportation. And that's where our concern is, and maybe that's similar to the psychiatric part of it. They have to be transported somehow. It seems that there was some question raised that maybe we had a contract or should have a contract with a secondary ambulance company for those situations. I don't think that's the feeling of Hazel Hawkins, is that we have a contract with an ambulance company, and what we're asking today is to have the opportunity to sit down with that contract and see if there's a possibility of including in that contract the, I guess you can call it so-called non-emergency transportation. It doesn't happen that often, but it does happen. And when you do that, if AMR delays it or is not really accepted to the idea, then yes, we have to call some ambulance company from somewhere to come in. And sometimes you do get hours and hours of delay, sometimes there's days of delay from another ambulance company coming in. In a way, as a taxpayer, I feel to a certain degree that we have a contract with an ambulance company here. We pay a tax for that ambulance company on our tax bill, and that it should include more than just the 911 part of it, that if we can't serve them because they need a specialty that we don't have, is that our obligation there to find that specialty for them, which we can, but to transport them there too? The second part of that too is when you transport non-emergency, the reimbursement is less. So it really comes down to a lot of times to the dollar, that not that many ambulance companies want to do it because Medicare plays very, very little. And some other insurance companies, they'll accept it because the dollar's not that bad, but it's less than standard. But when you get down to the lower end, that's where the refusal comes in. And financially, I don't blame them, but somebody has to transport those people to another facility with the specialties. And that's our concern. We would like to have, like I said, we didn't have the opportunity to be part of the contract or discuss the contract. And we'd like to certainly have that opportunity. Hope there's a solution to what our concerns are.
Thank you, Gordon. Supervisor Botello?
Yeah, I just have a question, Gordon. The hospital is part of the Emergency Medical Care Commission, aren't they? And
Yes.
they're the representative, I don't think you're on it.
No,
but
there's a rep on
whoever's
it, yeah.
Representative, they weren't bringing information back to your hospital board as far as where we're going with this contract?
Well, it wasn't brought to the point that the contract's up for renewal.
Uh-huh.
Yeah. We have expressed our concern continuously, but it doesn't seem to set with anybody's.
You know, the only, I think.
I think it's $1. It's the end result, it's $1, so.
Okay.
But then again, I say it's, we're one of the, I'm not trying to throw any burden out there either, but in the state of California, we're one of the few counties that does not have a county hospital. And that's where a lot of times these things are picked up by the county hospital. You got Natividad, you got San Jose, we're surrounded by county hospitals. But Hazel Hawkins is the only hospital in the county. So again, maybe we feel from our point of view, should we absorb everything in the county because there's only one hospital, but we're not the county hospital? So.
Yeah, and that's why, I got blasted a minute ago by somebody, but I feel working with your district is hugely important with the county, and we just have to find resolutions on some of these issues. And, now that we're talking about the ambulance contract, this is the appropriate time, and I'm happy you brought this issue up.
There was a while back when I first came on the board, a couple of issues came up, and at that time, the board had a medical subcommittee, or I don't know what the title of the subcommittee was. I remember Pat Lowe was on it, and we met in the back room a couple of times and talked about some of these issues like this. But I haven't heard of that committee being activated for years. So maybe it's time to, a couple of members from our board and a couple of members from your board sit down and talk about some of the mutual or county concerns. Thank you.
Supervisor Barrios?
Thank you, Mr. Chair. Gordon, your comments are a concern, and I think you've got valid concerns that we need to address. I think the only thing that I have a problem with is that I'm almost sure that we're out of contract with the ambulance service already. So how do we address that issue? I need to get answers to that before.
You're renewing the contract today.
Well, if we decide to not renew it because of the issues that you have brought up, which I think are valid, then
Well,
we
I
need to.
think the same request that was beforehand, that if you can delay it, for we can have an opportunity to sit down and talk about things that we see that aren't in the contract that maybe possibility can be added.
Yeah, because these are the contractual, issues that need to be addressed, but we are out of contract already with the ambulance. So I need to get answers from Jim
Yeah,
as to how to proceed then.
Yeah, like I say, the psych is only one part of the delay in transporting the
Right.
patient to a specialty hospital.
All right, well, I'll get my answer from Jim then and see if the timeline, because we do need, I believe the contract with AMR ended on September 30th? Okay, so if I can get that answer from Jim as to how in order to address your concerns, how do we delay approving the contract and be out of contract at the same time? So, okay, thank you, Gordon.
Thank you.
Thank you, Mr. Chair.
Yeah, because I saw that too, Supervisor Barrios. We were under a 90-day extension, and I feel this should have come before us, before that 90-day extension had expired, and it seems like it expired about 7 or 8 days ago. And so, what?
We were under a 90-day extension at the request of AMR. We acted on bringing the contract back to the board as soon as we got the information from AMR. This particular contract deals with 9/11 services, basically pick you up, take you to the hospital. It does not deal with take you to the hospital, or take you from the hospital to someplace else. I think that would be a separate discussion and could be part of a continuum of care discussion on how healthcare delivery is done in San Benito County. And I know that Health and Human Services would be happy to sit at the table, and I know that AMR, in the discussions I've had with them, would be happy to sit at that table and have that discussion from a community perspective. This contract is the 9/11 contract. This contract is pick you up at your house, take you to the hospital. The other issues would have to be incorporated in other decisions and other contracts, at least in my view, that the county, the city, whoever, would want to consider.
Okay, so then my follow-up question to that, Mr. Chair, is what you're saying, Jim, then, is that this is a standalone contract. If we wanted to add services such as transporting 5150 from Hazel Hawkins Hospital to Fremont,
Yeah.
we would need to have a separate contract for that, and it would have to be, somebody obviously is going to be responsible for the dollars.
Well, that would be my view. I would, defer to council on that, but in my view, this is specifically to 911 services. This is get you from your house to the hospital.
Is AMR in the house?
Yes, they
In
are.
the building?
Would you like to
Oh,
talk
they
with
are,
them?
okay. Well, good, because they may have to answer some of the questions
Yeah.
on a new contract, or a
But-
different contract,
Yeah.
so.
So, and I agree with the speakers here today, that there is an issue, and in fact, we talked about this a little bit yesterday. There is an issue of healthcare delivery in San Benito County that needs to be addressed from a community perspective. This is not an unusual issue. San Benito County doesn't stand alone on this. Most counties across the country are struggling with these issues, particularly the mental health issues. You read about them in the newspaper all the time. We say we need, better delivery systems and so forth. There's opportunities to have those discussions. Are there opportunities to pay for that? I don't know.
Exactly. All right, thank you, Mr. Chair.
So Jim,
Yeah.
is the only contract we have with AMR is to provide the 911 service?
That's my understanding.
So these other services that are being discussed today, there is no contract for those services to be provided?
I don't know. I just know what I heard today. I don't think there is any contract for those other services. It is not part of this contract.
It's the pay fees, you pay your own.
Mr. Chair, could we hear from AMR and see how that can happen, and if they are familiar with other counties that are doing a side contract for those kind of services? I really would like to know.
Actually, before, Mr. Chair, I got several questions to ask. May I ask the questions?
Yes, go ahead.
Thank you. And it might actually go to both Jim and the gentleman. I'm looking at the contract, and I'm listening that there might actually be some fiscal consideration, and especially in this contract, that it might jeopardize or it might get to the limit of the 10 minutes within the city and then 30 minutes outside. I'm very concerned because I know members of the audience have always heard me say this, and that is, I'm always concerned for the west side of Hollister. Even though we might reach we're at the 10-minute cap, which is the requirement. And the moment a call comes in, you've got to be at a house at 10 minutes attending to that person. My concern is the placing of the element services trucks. If they're within the 10 minutes, say they're at 9.55 minutes, whereas somebody on 5th Street gets it within 4.55 minutes, a 5-minute gap or 3-minute gap, it's a life-changing. Can really, really make a difference. Somebody can survive going to the hospital or not. And that's my first concern. If fiscal issue is an issue, I want to make sure that that does not get compromised. My second question is, are you going to relocate the elements, I pronounce the word, the trucks? Because I know there's one by going to San Juan, right? There's one station there. And then there's another one station at Fairview Road.
Hillcrest.
Hillcrest? Is that what it is? Yeah. So those two logistically allows for you to reach it within the 10-minute, correct?
Yes. Come on.
Okay. And then the other question is, Jim,
Oh, come on.
When is the time going to come for us to say, well, maybe we should talk with the fire department? Maybe the time has come. If the ambulance services cannot be provided, or it jeopardizes or compromises or reaches that line where it's compromising, should the fire department come to the table and start talking?
Okay? And I actually think those three questions are good questions for my colleague here to answer.
Mr. Chairman, members of the board, Doug Petrick, I'm the general manager for AMR in San Benito County. To your last question, when do you bring other people to the table? That's certainly up to you as a board. AMR has been meeting all of the contractual requirements that you see before you. We have been doing that for the last 5-10 years. So it's not an issue for us. The location of the ambulances, we will be probably relocating the Hillcrest location. We're probably going to try to get something a little more central to help us, like you say, with the west side of Hollister. The challenge is during the daytime, my ambulance could be downtown. It could be at the hospital. It could be, in another location, not just at our station. So, if you just happen to be close to it at that time, you're going to get the 2-minute response, not the 8-minute response. So those things happen. We try to build our system to service the majority of the calls in a timely fashion. So, you're never going to be able to say everybody gets it at 4 minutes. Everybody gets it at, 8 minutes. That's why you have this range that's in the contract. And like I said, we've been meeting that range ongoing, and we believe we can continue to do that. As far as, I agree with some of the prior comments here, we really do have two issues before the board right now. Today, the issue that is on the agenda is our 911 contract, and it's specifically for emergency transportation, response and transportation. The other issues brought up, we are very much aware of them. We do everything we can to try to work with Hazel Hawkins in moving patients. That comes up short. I'll be the first one to tell you, it comes up short. When we get a request from them, we spend a lot of time contacting partner agencies out of the Santa Clara area to try to move these patients when we're not able to. We try to bring in crews from off-duty to transport these patients. Because if we take one of our ambulances out of this county and send it to Santa Clara, send it to San Francisco, send it to a mental health facility in Napa or Merced, you got one ambulance for your emergency responses for a long, long period of time. And that's just not going to be real serviceable for the emergencies that we deal with on an ongoing basis. About a year and a half ago, AMR put on an extra ambulance specifically for doing transportation, non-emergency transportation within this county. And we actually thought, well, the call volume in this county, non-emergency, is pretty low, so we'll try to share it between Santa Cruz County and this county. Even sharing it between the two counties, there was not enough call volumes to pay for the cost of the unit that we had on duty, so we had to shut it down. That's our biggest challenge, is there's just not enough transportation to pay for that level of service, having an extra unit available.
Yeah, and the question I have while you're talking about that spare unit between Santa Cruz County and ours, was that a BLS or ALS unit?
It was both. Depending on we tried to staff at ALS, but if we couldn't, we would staff at BLS so that we could still move patients if we needed to.
Because maybe that might be part of the solution, is a BLS rather.
Yeah, there's not enough volume.
Okay,
not enough volume.
I know what an ALS is, but what is a BLS, please?
Basic life support. It'd be 2 emergency medical technicians with no paramedic. So, again, I actually am the general manager over AMR for Monterey County, Santa Cruz County, and San Benito County. So we try to work within our system. We utilize Monterey services for nurse transportation, sometimes out of Hazel Hawkins when we can. That's contractually required in Monterey County, but we will pull it out of there, and Monterey County has allowed us to do that on occasion. But it's certainly not something they like us to do. My concern today is if you try to combine the non-emergency piece with the emergency transportation piece in this contract, that you will have a real challenge with your provider being able to be financially stable in this area.
So then may I ask, can you get together with our HHSA director, with Hazel Hawkins Hospital and mental health director, to see if you can think outside the box to figure out a solution for us? Because I think that's one of the issues that we have, is there's a stigma, mental health. It isn't serious, nothing, it's no big deal. It is a big deal that we need to address and we need to take care of. So can we ask you to do that?
We're more than happy to do that. One of the challenges with mental health is, you heard them come up here and say the patient ends up in the emergency department, gets medically cleared,
right,
okay, to go to a psychiatric facility. Well, unless they're, a lot of times insurances don't pay for that because there's no medical necessity. Okay, so unless they're physically or chemically restrained in some way, some insurances won't pay for those services. Then, then the other comment, most of them are state Medi-Cal, which is a lower reimbursement, which makes it even. Those are the challenges we deal with trying to provide that level of service for the community. But we're more than happy to continue to talk about that. There may be cheaper ways. I know in another area that I operate in, we've used I heard the term cage car. We like to call it a safety car, where you have a single driver in a vehicle that the patient, the mental health patient, can be secured in the back and not harm themselves or jump out and run away while you're driving down the road. So there are other options out there that we can talk about.
I'd like to give that direction, Mr. Chair, if we could. Again, this is an item that is unrelated to this discussion, to this, other non-emergency issues. So I'm going to support that we move forward with it and take this to a different setting with discussion and further exploration.
Any other questions of the board? I do. Supervisor Botello?
Yeah, first off, when I saw this item, I got tell you, I'm very, very pleased that we're contracting for another 5 years with AMR, because I, for one, don't have any complaints with the level of service. You have 2 ambulances. I'm not sure what that threshold is per population, per ambulance, but hopefully, maybe in the next few years, this community is to see some growth. And we may have to add to this probably within the term of this contract, and I'm not sure what that tipping point is. One of the things, though, I may have to ask is the labor situation with AMR and their drivers and staff is pretty sound at this point in time. That, there for a while, I don't know about the rest of the board members, but I was very, very concerned that we have to look at other options, and I'm happy we're not. But if that occurrence happens in the future, do we have enough built-in notification time within this contract that we could, react to?
Yeah, and the request for the extension, 90-day extension, was related to a labor issue that we were working with the union on. That issue was resolved and moved on. We're still in negotiations with them for a long-term contract. So, again, you got to come to agreements and compromises. So that hasn't happened yet, but we're still actively, trying to resolve that with them. So.
Mm-hmm. Okay. Thank you.
Just to point out, there's a part of this contract that I don't believe has been there before, and that's a reopener on a yearly basis, so we could sit down and have these discussions. But on the other hand, I found AMR to be just really open to coming and sitting down and let's work out issues, which has been very refreshing for me.
Any other questions of the board members? I'll open this up to the public. Anybody from the public would like to address this item? Seeing none. I guess my only comment, and it's not really necessarily related so much of this item as all these items that have been kind of grouped together. I think we need to look at maybe forming some kind of committee that where the county and the hospital district are meeting on a regular basis and discussing these issues, so that we seem to kind of keep coming back to this where the hospital district is left out of the loop when we're making decisions that affect them as much as it affects us. So we'll bring that back at a future date. So what's the pleasure of the board?
I will make a motion, Mr. Chair, to approve a 5-year ambulance agreement effective October 1st, 2014 through June 30th, 2019 for AMR to provide ALS and ambulance transportation services in the San Benito County EOA, and authorize the chair of the board to sign this agreement.
Second.
We have a motion and a second. All those in favor?
Aye.
Aye. Those opposed? Passes 5-0. Thank you, Jim. With that, I think we'll take a 10-minute break, and then we'll start our public hearing and our regular agenda item.
slow, isn't it?
Yeah, because it didn't shut down right. It's doing running through its whole cycles.
Okay, we're on the zip drive.
Okay. I think it's connected. Cool.
No, I can't.
Yeah. One second.
Okay, good. Still isn't open.
By the time I get done, it'll probably.
We'll move on to item 12, which is going to be a public hearing. Mr. Juror?
Thank you, Mr. Chair and members of the board. The County Board of Supervisors is requested to conduct a public hearing on a proposed ordinance that would amend Chapter 19.21 of the San Bernardino County Code to implement new procedures regarding determination of exemptions from Measure J, which is the initiative regarding petroleum operations to be voted on at the November 4th, 2014 election. This item did go to the Planning Commission in September. If approved by the voters, Measure J would become effective within weeks of the November 2014 election. This action is not intended to support or go against Measure J. It's simply an implementation ordinance in order to provide certainty for the community and to reduce litigation risks for the county. The purpose of these amendments is to codify a county process for considering and applying the exemptions stated in the initiative. County Counsel's Office has prepared a presentation to explain further the hows and whys of this item, and this is more of a County Council item at this point than planning, so I'll turn it over to Barbara.
Okay, the proposed ordinance codifies an administrative process for processing claims of exemption in the event that Measure J is approved. It neither enlarges nor narrows the exemptions contained in the initiative. There's copies of the PowerPoint in the back for anybody that needs it. The ordinance is proposed by staff, not by the proponents or the opponents of the initiative. It was derived from an ordinance developed in Santa Barbara County, which also has a very similar initiative pending. It's my understanding that it will be going to their Board of Supervisors, possibly on today's date. Let's see. But it was approved by their Planning Commission as a recommended action. Our Planning Commission supported this, this proposed ordinance to the Board of Supervisors. In Santa Barbara County, some of the main concerns were the cost of the application process. They set a fee, a deposit fee of $5,000. And they had also raised the fact that there was no defined definition of vested rights. And so how we're going to address that if that becomes an issue is just provide further guidance in the event that Measure J is approved. But the proposed ordinance protects the county from potential takings claims by allowing the county to evaluate and act on claims of exemptions as expressly allowed by the initiative. The summary of Measure J, it prohibits through new general plan policies and new county code, zoning code sections, land uses in support of all petroleum operations in county residential, general plan, land use designations, and in rural and residential zoning districts, and I have them listed there, and all high-intensity petroleum operations as defined by the initiative in all unincorporated areas. And the high-intensity petroleum operations, of course, includes hydraulic fracturing and enhanced recovery wells such as steam injection. Measure J, Measure J itself provides for 4 different types of exemptions or exceptions where the general prohibitions of the initiative may not apply, and 3 of those are addressed in this ordinance. Section 5 of the initiative provides that provisions of the initiative shall not be applicable, but only to the extent that they would violate the Constitution of the laws or the laws of the United States or the state of California. That's not addressed by this proposed ordinance because that would have to be adjudicated by a court. Number 2, an exception may be granted when application would constitute an unconstitutional taking of property with any such exception allowable only to the minimum extent necessary to avoid an unconstitutional taking. That's set forth in Section 5 of the initiative. The findings required under the proposed ordinance to approve a Type 2 exemption, that there is sufficient evidence in the record to determine that approving or conditionally approving an application is required in order to avoid an unconstitutional taking of property, and that the application, as approved, will allow additional or continued land uses only to the minimum extent necessary to avoid such a taking. So I will note that we're not evaluating, not adjudicating a taking itself. We're actually determining whether a land use can be approved as an exemption to the initiative in order to avoid a taking. So there's a slight difference there. The filing of an application for a Type 2 exemption should normally be accompanied by an application for a development project. The developer, the director, the planning department may waive that requirement for good cause, but even if that requirement has been waived by the director, if the Board of Supervisors finds it's necessary to have an application, it could require that that application could be filed. Measure J, this third type of exemption would be Measure J does not prohibit low-intensity petroleum operations that have obtained a vested right under state law. The initiative does not state who will determine that the existing use has obtained a vested right or an appeal process for that determination, and the proposed ordinance does set those forth. The finding under the proposed ordinance to approve a Type 3 exemption is that there's sufficient evidence in the record to establish that the applicant obtained, prior to the effective date of the initiative, a vested right to conduct a low-intensity petroleum operation. The fourth type of exemption of the initiative would be that allows the Planning Commission to extend the amortization period, which is the time period to cease operations for a high-intensity petroleum operation for up to an additional 2 years, so that the amortization period could be as long as 3 years. The findings required for that was that there's sufficient evidence in the record to establish that the applicant has obtained a vested right to conduct the high-intensity petroleum operation, that approving or conditionally approving the application is required because the 1-year amortization period is not a reasonable amortization period, and that the extension is only the amount that's the minimum length necessary to provide a reasonable amortization period. Now, we haven't attempted to change the language that's in the initiative. This language and these findings comes from the initiative itself, so we're not enlarging or narrowing it. It's just codifying what the initiative says. There is a summary of the decision-making authority. The Board of Supervisors would decide the unconstitutional takings claim, whether an exception should be granted due to an alleged unconstitutional taking. The determination of vested rights for low intensity would be made by the planning director with appeal to the Planning Commission and the Board of Supervisors. And the determination of exemption for the amortization period for the high intensity would be Planning Commission and the Board of Supervisors for the appeal. In summary, the need for the ordinance is that it reduces the risk of litigation against the county, because if an administrative process exists, a taking claims is premature until a landowner has obtained a final administrative decision regarding the application of the regulations to his or her property. And it provides and codifies a process by which persons entitled to apply for an exemption of the initiative may do so, but it does not expand the exemptions set forth in the initiative. Does anyone have any questions?
I just have a comment, if I could, Mr. Chair. On this summary of decision-making authority, this, if somebody wants an exemption, they have to go, there's a process, and looking at this, there's like a 12-step process that they have to go through in order to get to where they need to be. Plus, they will have to pay a fee as well. And then at the very end, if, let's say that the planning department, planning commission says, you know, they are not exempt, they can appeal it to the Board of Supervisors. Is that correct? So the Board of Supervisors can use their discretion, or is it the planning department that uses their discretion on whether they approve the exemption or not?
It's set forth differently for the different types of exemptions. So for example, if it's based upon an unconstitutional taking, it will come directly to the Board of Supervisors. And I envision that how we plan that to happen is it would come to the Board of Supervisors for a decision on the exemption.
and you would determine whether or not it's exempt from the initiative, and then it would go, since it would normally be a conditional use permit for a new well, for example, then it would go back to the planning commission for an action on the conditional use permit.
Okay, so
Now,
then
if it was an issue on the amortization period, then it would go to the planning commission. The planning commission would make its decision on whether the amortization period should be extended, and then it would come to the Board of Supervisors for approval on appeal. I mean, if it was appealed.
So
And if it
only on
wasn't,
the constitutional part of taking of.
that's the only one that starts with the Board of
That
Supervisors.
starts with the Board of Supervisors, and really, it's up to the Board of Supervisors. They don't follow any, there are no set rules or laws that we will look at. It's strictly discretionary.
Well, I think that once we get those type of applications that are filed, that the board would have to be briefed and informed prior to the hearing about what the state of the law is to avoid an unconstitutional taking, and an analysis of the facts of that specific application to the case law that's on the subject. So we haven't defined it on the initiative, on the ordinance itself, but the board would get more information before it actually makes the decision, saying these are the cases, the realm of cases out there, so that you have a factual, that you have a summary of the law that's applied to unconstitutional takings cases.
The problem with that is there probably will be no cases out at that time, so it'll be up to this board to determine whether that, I mean, it could be a very unfair process just simply because if the applicant does not have the proper findings, it's really up to us to say yay or nay with no real, case information to base these decisions on.
So
Just wanted to
it's
say
not
that.
completely up to the board. The board doesn't have a complete blank discretion. You're right in that Measure J and these type of ordinances are going to present some new ideas to the county. But there is an established body of law on the takings issue. There is some requirements within Measure J itself, some criteria that would have to be met to grant these exemptions, and the board would have to make the requisite findings. So in other words, just taking the vested exemption, evidence would have to be brought before the board to show that the oil operations was up and running for a period of time prior to the enactment of Measure J. So there's a factual basis there. And if the appellant can't establish that factual basis, then the board really has no discretion to grant that exemption. So it's not completely open-ended. Yes, there will be some new questions of law or fact that the board has never, or the courts have not been confronted with before, but there will be a substantial amount of guidance also.
Yeah, I think what I'm concerned about with is the unconstitutional taking of property. That is so open-ended, and it's so subject to interpretation that I think we're going to have a problem.
Well, again, there's actually a pretty well-defined body of law that discusses that, and actually, somebody who came before the board on the takings issue would have to come forward with some facts. They'd have to have a lease, they'd have to have an agreement, they'd have to have something in writing showing that they had an option to something, some sort of oil or mineral rights, and that if they weren't allowed to develop those rights, they would suffer a financial loss, and they would have to prove what that financial loss is. So again, it's not completely open-ended. They have to come forward with some evidence. There will be some close cases, and at all times when there's close cases, the board will have to use its collective wisdom and discretion to decide who's right and who's wrong.
Thanks, Barb. Thank you, Matt.
Mr. Chair, so Matt, what you're saying, at the end of the day, doesn't matter, the county will have to pay those funds, right, at the end of the day?
Well, I think you've jumped ahead a little bit. If in fact there were a takings, which this particular ordinance is trying to address and help prevent that consequence from occurring, there is the possibility that the county would be financially liable for those takings.
I mean, I'm just thinking right now about this, in fact, this one right here, where it says, you have 2 years to amortize a business, and, in the world of business, and I actually work for a private company, someone to tell me I'm going to have to shut the collections of my tires, I'm going to say, hey, you got to give me time enough for me to move my operations and make sure at least I make, a break-even situation, because if it's a loss, I'm sure coming after the county for that case.
Yeah, that's definitely an issue. There will be questions as to whether 1 year or up to 3 years is sufficient for the amortization. But our hands at the county level, at your staff level, at the board level are tied by the specific language of the initiative. We didn't write the initiative. We didn't pick the 1 to 3 years. That's being forced upon us.
And that is the problem.
That is the
we
problem.
are tied to the
Yes.
words that are in the initiative, so your hands are tied.
Yes, and it gives the county some additional time to process these type of applications and see what happens with the initiative if it is passed. I think it's highly likely that it will be challenged either here or in Santa Barbara County. So it will remain to be seen what happens if it does pass, what happens after that.
And I think there's specific, if I still have the floor, Mr. Chair, that there is specific language on here that the county is responsible for defense on
Yes.
anything on that initiative.
Yes, that's built into the initiative.
Yeah, and the public doesn't know that. I mean, I hope they know now that if this passes, the county is responsible for the defense of the initiative. So get ready, folks.
It's a major undertaking.
It is.
And are we going to start hiring people just in case? Because it looks good for Measure J. Are we going to start, are you going to bring some kind of proposal to the board? And
I think we'll wait to see what happens on Election Day. But obviously, we're thinking of it. Obviously, that's why we're in front of the board today with this preemptive measure, this ordinance in front of us to address the temporary takings issue, to provide a administrative procedure to allow people in the community to think they were grieved by Measure J to come forward and seek the exemptions that are within the initiative in front of either the planning director, the planning commission, or the board of supervisors, or all three in some cases.
Okay. Are there any other questions of the board at this time? Okay, with that, I will open up the public hearing. Do we have any speakers cards?
Marty Richmond?
Still good morning. Good morning, Marty Richmond from Hollister. I will stick to the subject, this particular subject. There's no question where I stand on the measure. I made that clear this morning, but this is a different subject. So I'm going to put on a different hat. I'm going to put on my homeowner's hat, and I'm wearing my homeowner's hat right now. I'm a homeowner, and I'm a person who lives in this county, and I expect the Board of Supervisors to protect me. I no longer teach constitutional law at Harvard like I used to. I want you to protect me the way you protect everybody in this county. You're supposed to protect everybody in this county financially. I can't tell you what the right thing to do is on this because I really don't know. And the odds that there'll be a lawsuit, I don't know. Because sometimes people sue, other times they say, this is not worth my effort, and they go away. I do know the people who are promoting this, and I know some of them individually, sue for everything. They've sued the solar guys, they've sued over 156, they'll probably sue over 25, and they'll sue over everything. So they sue for everything. Whether the other side sues for everything, I have no idea. But in America today, it seems like everybody sues for everything. So the odds are that somebody will say, even if I'm going to lose, my punishment will be the lawsuit. And I noticed the other day you had a lawsuit on your closed session agenda that I thought was dead and buried 5 years ago. The Los Valientos was back, the dreaded lawsuit. So I hope you will take whatever action is required to protect the value of my property. I don't want to wind up with $1 million or $2 million or $5 million property assessment, total property assessment for the county because we owe somebody a lot of money. So I expect you will do that. I encourage you to do whatever it takes to do that. And your primary advisor would be your counsel because he is neutral on the issue. Thank you for your time.
Good morning. I'm here to, first of all, thank the county for providing this proposed implementation ordinance. And I'd like to urge the board to adopt the proposed implementation ordinance for Measure J because I believe it's fair and balanced. It provides a lot of protection for not just our water, the health of our community, and the environment, but also it protects jobs. It protects the jobs in agriculture, which is really reliant on the water, and also it protects tourism. Having a massive oil field, for example, outside of the Pinnacles would be pretty devastating. The proposal was several hundred, up to 1,000 oil wells, and that was in the recent Farm Bureau report of the Citadel project and the economic impact. So the other thing I think that it helps protect is actually property rights. There is a rancher, Charlie Henkel from Spur Ranch, who has the Citadel project on his property, and he is very opposed to it. He is a supporter of ours and a donor. He happens to have something called split estates. He owns the property, the surface property rights, but he does not own the mineral rights. So someone else, in this case Citadel, who has leased the mineral rights, is able to come onto his property and do pretty much what they want because mineral rights, unfortunately, in our country, trumps, in our state, trumps property rights, the surface rights. So even though he has said, you know, he has paid property taxes, the mineral rights folks do not pay property taxes. He still has to allow this to happen, which would be devastating for his ranch. And he's a rancher. So I wanted to point out that besides protecting private property rights, this measure would also allow conventional drilling to continue. There are about 28 active wells, and those ones are conventional, involving pumping the oil out of the ground, and those will not be affected by this measure. So we think the group that's supporting Measure J thinks that this is a very balanced and fair measure that would really protect our entire community. Thank you very much.
Good morning. I am Margaret Rebecki. I would like to urge the board to adopt the implementation ordinance for Measure J. And I have a list of all endorsers from San Benito County. I am so proud to say that I have lived here for 40 years. And I've been in politics for many, many years, I think you guys know. But I have to say, this is the most important measure that's been on the ballot, I have to say. So many people are involved. We have business, farmers, you could see the list. We have political community leaders. We have medical doctors, we have businesses, educators, people that are well educated and do know what Measure J is about. And I like to say that, you know, I have 20 acres in Hernandez Valley, and, you know, I love John Eade, and we bought it from John Eade. But I like to say that I don't have the mineral rights, and I don't know who has the mineral rights. Whoever has them could sell them to the petroleum company, and they could go in my property and drill, baby, drill. And I do not want that drilling there without my permission. Do I have rights? I hear everybody crying, "You're taking my rights away." Guess what? I have rights too. And I like to say that, you know, where I live in Hernandez Valley, I have a small little cabin. It's beautiful. It's like being in heaven. But soon as you pass half an hour. We're in Coalinga. It seems like I'm in hell because you see all these oil wells there. I don't see anybody working there. You just see these empty little things. And let me tell you, there's no jobs there. It is the poorest community. They have the most pollution there, contaminated water. Real estate is way down. Go buy a cheap house. Nobody is dying to go look for jobs, and they're paying them well. Nobody is looking for a cheap home. It is ugly. And why it is ugly? It is because we have oil drilling there. Do I want this in next to our national park? No. Do I trust the oil companies? No, I do not trust them. And I like to say that when we say we protect San Benito County, we are protecting it. We want it beautiful. Let's look at ecotourism. Let's look at clean jobs. Let's bring solar energy. Let's bring wind energy. We have vineyards here. We have the Olive Festival. We have a beautiful national park. That is what we are protecting. And let me tell you what the oil, when the No on J wants to protect, they are protecting their pockets. It's money. Thank you.
Christina Chavez Wyatt.
Hard act to follow. Good morning, Mr. Chairman, supervisors, staff, neighbors, visitors. As most of you know, my name is Christina Chavez Wyatt. I'm Executive Director of San Benito County Business Council. I'm a chamber member, Farm Bureau member, California Women for Agriculture member. I'm a member of Working Families here in San Benito County. I own a business, a home, and a property here. I'm also a consultant to San Benito United for Energy Independence. As we discussed in the meeting on the 23rd, Measure J has been pitched to our community as a ban on a long-used but newly controversial oil and gas production technique, hydraulic fracturing, or fracking, a technique that is not used, proposed, or planned here in our county. However, the ballot measure is a part of a statewide campaign by anti-oil political activists, including many, many outsiders that will be inundating our community this weekend, being bussed in from the Bay Area, that would prohibit a wide array of other techniques that have long been relied upon since the 1960s by California's petroleum industry to enhance well performance, including the use of steam. Furthermore, the measure arbitrarily bans high-intensity operations and does not define low-intensity operations. The ballot measure's effect, according to representatives from 2 petroleum companies active in this county, would be an immediate end to new energy investment locally and eventually a shutdown of production of the 26 wells active in our county. As our existing oil operator and employer of 3 Hollister residents, Mr. Steve Coombs, who is president of Patriot Resources LLC, has stated, if anybody needs convincing that Measure J goes too far, they don't need to look any further than what our county council and planning director are saying about the potential consequences of this flawed ballot measure. While staff deserves credit for trying to lessen the damage of Measure J, the best remedy is for voters to simply reject it this November. In their report, staff points out that while Measure J contains language for providing exemptions and postponements for property owners and investors on a case-by-case basis, the measure is utterly silent on how to request them, how those decisions would be made, and what standards would be applied, much less how much time and effort staff would have to spend addressing these concerns when we have much more pressing issues in our community, such as land use permits and our general plan. Measure J is a 10-page general plan amendment that would provide and open a Pandora's box of uncertainty and litigation that would be bad for business, bad for our local economy, bad for our community's fiscal well-being, and a very bad message to those who are investing and seeking to invest our community at every level. Measure J infringes on property rights and is an assault on the individual's right of self-determination on his or her own property, as stated by the Farm Bureau and the Cattlemen's Association. Measure J simply goes too far, and that's why all major agricultural and business organizations in our region are officially opposing Measure J, including the Farm Bureaus of San Benito and Monterey County, California Women for Agriculture, and our local Salinas Valley chapter, the San Benito County Cattlemen's and Cattlewomen's Associations, the Salinas Valley Chamber of Commerce, the San Benito County Chamber of Commerce and Visitors Bureau, and the San Benito County Business Council. thank you again for the opportunity to comment on this very critical matter facing our community. Thank you.
Thank you very much for the opportunity to speak. I don't have anything written down, so forgive me if I just throw out a bunch of jumbled thoughts. First, I'm going to say that I'm somewhat perplexed by the whole minutia that seems to be going on. The only way that I seem to take this as either the board is anticipating this passing or encouraging it to pass. Both ways leave me somewhat dismayed. I forgot to mention earlier, my name is Richard Bianchi, president of the San Bernardino County Farm Bureau, and I brought something for you today. I've got a reference book that is the crop report from San Bernardino County, which is $330 million generated by agriculture. I'm going to give that to you, as well as a list of people that contributed to that $330 million. To say I have a recommendation would be an understatement. I think my concerns were stated. To say that to make this recommendation, I don't know that it's needed. To say that it won't be needed in the past, I can't say that. But it seems like we're somewhat jumping the gun. Thank you very much.
Would anybody else like to address the board at this time?
Good morning, Chairman, ladies and gentlemen of the board. If there's anything from me sitting in the audience that would indicate, if there's anything that has become clear throughout this entire process, it's that Measure J is vague and ambiguous as to what activities are allowed and where. I'll give you a short example. Slide 5 included a list of general plan designations where there would be a prohibition on oil and gas operations. Half those go away when the second you guys adopt the general plan update. So what happens with the designations that are listed in the general plan? What happens with the new designations that come up that are residential that aren't listed on the initiative? Can the board make a decision to substantively change a policy of the general plan that's adopted by initiative? This ordinance, which proposes a process to obtain exemptions from Measure J, doesn't clarify the ambiguities inherent in Measure J. I submitted an 8-page letter to the Planning Commission on this ordinance, and will spare you the details. I do have a copy here I brought with me in case it's not included in your file. I'll give it to Ms. Tomei to put into the record. Really, the bottom line is that Measure J is confusing, and this ordinance is unclear. And the only way to avoid confusion and expensive litigation in this appears to be for voters to understand the consequences, both intended and unintended, and to vote down Measure J, so that this board can use its existing policies, including the 21-page Title 19.21 that was just adopted last summer, and its other processes and enforcement tools to protect water quality and human health, which appear to be so important at this time. Thank you very much for the opportunity to address you.
Thank you, Chair, members of the board. Good late morning. My name is Jason Rutterer. I'm speaking on behalf of San Benito United for Energy Independence. My client has serious concerns about the county's failure to comply with the California Environmental Quality Act prior to taking action on this ordinance. The letter that Mr. Ravello was referring to earlier also highlights some of the concerns regarding CEQA compliance. In general, enactment of ordinances are subject to CEQA. Nonetheless, the county maintains that no CEQA review is required because the ordinance is procedural in nature and wouldn't have any environmental impacts. The findings are flawed for several reasons. First, the county has improperly piecemealed the project in order to make this determination. CEQA defines a project broadly to include the whole of the action. In this case, the whole of the action includes not only these exemption procedures that are before you, but Measure J itself. The draft ordinance even cross-references sections of Measure J in the statement of purpose and intent. The two are tied together. Because the county has chosen to prematurely move forward with this draft ordinance now, which is tied to Measure J, the county must undertake CEQA review of the entire action, including Measure J. The California Supreme Court confirmed this in the Friends of Sierra Madre case that is referenced in Mr. Ravella's letter, that any county action to implement an initiative requires CEQA compliance. Second, and when considering the whole of the action, it's clear that the ordinance is not exempt from CEQA. The staff report claims that the ordinance is exempt because it can be seen with certainty that there is no possibility that the activity will have significant environmental effect. That's not the case here, and there's no factual analysis to support that conclusion. As Mr. Ravella's letter explains, the elimination of oil production in the county means that oil supplies would need to be obtained elsewhere from locations that are far greater distances from existing refineries in the Bay Area. That means greater truck and train distances and increased emission of pollutants and greenhouse gases. The ordinance and Measure J will also create land use and blight impacts potentially by causing the abandonment of existing oil production facilities and potentially the redevelopment of these areas with alternative land uses. The ordinance and Measure J will simply shift oil and gas production to the incorporated areas of the county or other areas of the region that allow this kinds of use. The county makes no attempt to analyze the potential increase in production in other more urbanized areas or other existing oil production areas in the region. The California Supreme Court in this Muzzy Ranch County versus Solano County Airport Land Use Commission case held that displacement of development pressure can be an environmental impact that defeats the use of this common sense exemption. So I would request that the board table this item until staff is able to come back, prepare an initial study, analyze the environmental impacts. Once they complete the process, then the ordinance would be ripe for the board's consideration. Thank you.
Mr. Chairman, thank you. Marvin Jones again. I think I misunderstood part of this slide that Ms. Thompson presented. I'm sure I misunderstood this, that the Board of Supervisors can grant exemptions to avoid unconstitutional takings. I don't think the Board of Supervisors can make a determination on whether something's unconstitutional or not. Maybe you can, but I don't think so. I think that's my problem. I think I misunderstood that. Earlier, we had comments about all the drastic water problems we're going to have. We've only been doing oil extraction in San Benito County for 150 years. There's no documented case of contamination of water. Monterey County is much more active than us, than with their enhanced techniques, right there on the Carmel River. And there no water problems there. The drastic amount of water that's used in fracking, not in San Benito County because it's not practical here, is a little bit, it's comparable to a residence of a family of 4 in a year. The amount of water to frack one well is about a year's worth for a family of 4. Between 100 and 150,000 gallons. Agricultural industry uses a lot of water. A metric for you, the tomato plant in Hollister, when it operates, 2.5 million gallons of water per day. That's a lot of water. And we're worried about 150,000 gallons from some oil well. We're swatting at gnats while the elephants run wild. This Measure J is a bad measure, and I hope it is defeated. Thank you.
How you doing this morning? Good. I'm John Eade from Santa Ana Valley. I want to talk about liability and indemnification. I heard a lot of people talk about the potential for it, and we might be looking at some big lawsuits. I've been through that rodeo, Jay and I. 8 years ago, I came before the Planning Commission here for a zone change for the Spur Hotel in Tres Pinas. We went for the Planning Commission, and we were sailing pretty good until one planning commissioner demanded for his vote that we split the C District review from the zone change. 3 times on the record, I asked the Associate County Counsel and that planning commissioner, is this legal? Oh yeah, everything's fine. Planning Commission votes for it, 3-2. Goes to the Board of Supervisors. A couple of them are sitting on the board right now. They voted, approved the zone change. Here comes Rose Zoya. Everybody knows who she is. We're the ones that end up getting her here in the county, unfortunately, on the hotel deal, suing us. We had to indemnify the county. It cost us hundreds and hundreds of thousands of dollars. Didn't cost the county a penny. There's nobody going to indemnify San Benito County in this Board of Supervisors under Measure J. The only way we're going to indemnify San Benito County is to vote it down November 4th. Thank you for your time.
Is there anyone else that'd like to address the board at this time? Seeing none, I will close the public hearing. Are there any additional questions or comments from the board?
I have some comments, Mr. Chair, if I could. And I'm going to read my comments because I don't want to leave anything out. I just want to point out that it's amazing that 80% of the farmers and ranchers in this county are not supporting Measure J. You don't really believe that they're going to sit back and let their constitutional rights be taken away. Enhanced oil production has been successfully done in California over 100 years with no evidence of water contamination or increased earthquake activity because of our strict California regulations. I believe that the Yes and J proponents are using similar scare tactics, just like BLM used when they closed Clear Creek to the American people, with no known proof of danger, period. If Measure J passes, it will go down in history as the biggest mistake this county has ever made, with ill effects to property rights, the economy, oil independence, and the list goes on and on and on. Yes, on Measure J claims that this initiative builds upon our current ordinance that we passed just not even a year ago, maybe a year ago, but it's pretty new. It replaces it. It doesn't build upon it. So much for the time and effort that you meaning the committee, recently spent and the staff time to adopt this ordinance pretty much goes out the window. I know that the impartial analysis that was done was well-intended, and I thank staff for going to the trouble and the time for doing that, but it was done with the direction that the majority of this board, not me, but the majority of the board, has given county council. But it does nothing to inform the voters of the extreme risk the county is taking by putting Measure J, by having put Measure J on the ballot. I voted no on putting this on the November ballot, and this ordinance that is before us today reinforces why Measure J is such a risk. We wouldn't be doing this if it wasn't such a risk for the county, and it's not going to take away the risk. So the best way to avoid it is voting no on Measure J. Thank you, Mr. Chair.
Mr. Chair? Mr. Chair?
Supervisor Rivas?
Yeah, I wasn't going to say much until my colleague made those comments, which I believe are extremely off base. They're extremely off base because the only way we protect this county is by supporting Measure J and by voting yes on Measure J. Whether 80% of farmers and ranchers support it I have no idea, but I highly doubt that. The reason why you hear the no side say farmers and ranchers is because it polls high, because they did a poll, and the poll says, the people respect farmers and ranchers. But the truth is, if you look at farms and ranches that have succumbed to oil development, go to Bakersfield. It doesn't look like a farm or ranch anymore. It's an oil. It's disgusting. The only way we protect this community and our agricultural interests and the majority of our community residents and our water supply is by protecting ourselves, which is what Measure J does in eliminating the threat that high-intensity oil operations have to our natural resources here in San Benito County. You know, and I take extreme issue with the fact that outsiders are, you know, in control of this whole situation. When you look at probably 99% of the contributions from the no side, you know, is from outside oil interests. It's from outside, they've pumped nearly $3 million into this campaign. You know, and I, as a supervisor, I've lived here my entire life. And I have, you know, prior to any, you know, all of you guys have had to hear my rants over the last 4 years. And I was the first supervisor that came out and said I was against fracking from the very beginning. You know, I wasn't influenced by any type of outside agencies. I was influenced by my own opinion by researching and realizing the potential risks that high-intensity oil operations have on small communities, on local communities on the East Coast. You know, and this claim that fracking's been done for a long time, sure, fracking's been done for a long time. The reason why fracking is so controversial now is because they finally found this formula with water, chemicals, and sand that is producing results. You know, sure, fracking has been done for decades, but it hasn't been done the same way it's done now. That's why we have such a controversy, and that's why we have the issues that we've been having. You know, for me, this is all about risk. I could care less about the few people that are going to have their pockets lined by high-intensity oil operations. You know, I care about the majority of this community, the health, the public safety. You know, we hear local attorneys saying, let's be more like North Dakota. You know, more like North Dakota. It creates jobs. You know, in North Dakota, you have an increase in traffic, an increase in traffic accidents and fatalities from those accidents. You know, I'm more concerned about, you know, we had a reference about our crops. Our crops are at an all-time high. Now, are we going to really risk the threat of a potential a contamination that would ruin all that? Because I could tell you that if we have a contamination, crops are going to plummet. They're going to plummet. So with that, Mr. Chair, I'm done. Thank you.
Okay, so we're here, and again, we're here on this measure. This is county staff trying to be proactive if the measure passes to put in place some protection to the county so that the county would not stand to be sued, at least not sued as quickly.
Mr. Chair.
So, Supervisor De La Cruz?
Thank you. I just want to get this straight out because I know from the beginning I shared my position with the good fellows, the members of the community, trying to get the signatures that I was not going to stand in the way and I was going to support putting in ballot. Absolutely. I just want to make sure that what we're about to prove today in no way hinders that process, right? It doesn't hinder that, right?
Can you clarify that one more time?
Sure. This ordinance that we're going to approve today does not hinder anything of what's going forward, right? It's still gonna be on the ballot. The people of our community are still gonna vote it, right?
Yes. This is only in effect if Measure J passes, and the only reason that it's brought forth now to the board is so that it can be in effect if Measure J passes. So it does not affect anything if Measure J does not pass, and it doesn't influence whether Measure J will pass or won't pass.
Okay. So this is more of administrative work.
Yes.
Does this exposes us to risk by approving this today?
I think that you heard from one of the public comment speakers that there could be a potential risk if somebody is going to challenge Measure J. If it passes, they're going to challenge everything related to Measure J. No, we'll probably also challenge the ordinance. In addition to the claims regarding preemption, they're going to raise preemption claims. They're going to raise a lot of, allegations to try to get Measure J overthrown if it does pass. And one of the claims that they probably would raise would also be CEQA. So there's a risk, but you're weighing the risk versus the benefits.
Okay, I got two questions. I just want to out there so I can vote in confidence. The first one is about the CEQA issue. I think somebody brought it up. Or
Yes.
You did that. We don't have to do a CEQA, a measure. Is that the same concept as a hillside ordinance concept? Or
No.
It didn't require a CEQA process because we're basically elevating the protection of the land?
No, we're not using that exemption under this. We're using that it doesn't have an effect on the environment because it doesn't do anything that the initiative itself is not doing. They're raising the allegation that it's a discretionary action, that it has to include both the effects of the Measure J itself, and we don't believe that that's true. But it will be an interesting question. If it does pass, it will have to have a court decide that what would be the baseline that would be analyzed and what would be the effects of this initiative. We're saying that it doesn't have effects on the environment, it's just an administrative process.
Yeah,
But that's going to be something that will be decided by the court.
Because I think it does, and I think it does rise us to a level that we do have to do CEQA. But then you're the legal expert, so
Yeah.
I'll have to believe you on that one. And then my other point is that this does no way, and I'll say it again because I want to make sure, this is in no way supplements, supersedes, takes over Measure J, right? This.
No, it does. It does not. It follows Measure J and kind of implements it. Now, the only way that the board can get it approved in time for it to be in effect is if the board finds that it's exempt from CEQA. You know, if the board thought that it's falls under CEQA, or that there's significant effects, or that it needs to be analyzed, that would definitely take it out of the time frame to get it adopted prior to the election.
Okay, all right, thank you. Thank you, Mr. Chair.
Any other questions or comments from the board? Okay, what's the pleasure of the board?
Mr. Chair.
Can I?
Yeah.
I just want to read the title of the ordinance
Okay.
for the record. It's an ordinance amending Chapter 19.21 Oil and Gas Wells of Title 19 Land Use and Environmental Regulations of the San Benito County Code to implement new procedures regarding determinations of exemption for Measure J, and the initiative regarding petroleum operations within San Benito County, a measure to be voted upon at the November 4th, 2014 election.
And Mr. Chair, with the title being read, I'll move that our board make the findings set forth in Attachment A for approval, including that adoption of the proposed ordinance is statutorily exempt from the California Environmental Quality Act, CEQA, pursuant to Section 15061B3 of the CEQA guidelines, and accept introduction and waiver of the further reading of the ordinance, and continue to October 21st, 2014 at 9 a.m. for adoption.
Second.
A motion and a second. All those in favor?
Aye.
Aye. Those opposed?
No?
Passes 4-1. Thank you. With that, we'll move on to our regular agenda. Item number 14, Ms. Casillas?
Yes, we have item number 14 on our regular agenda. We're waiting for interim
Okay.
Georgia Cochran. And she will be presenting the grand jury report responses. Okay.
No doubt.
Can we adopt the modified procedures now?
Yeah, I thought the sheriff and the probation officer were to be here also. I thought the sheriff and the probation officer were going to be here also.
Sheriff was right in the response.
You want them here?
Might as well poll you now. We have a couple of closed item sections. Does the board want to take a lunch break, or do we want to work through the?
How long is the close item going to be?
I want to work through it
You want to work through it?
myself, but that's me being selfish.
That's Anthony. Don't pay attention to him.
Do we know if these items are going to take some time, Mr. Chair? Could we find out from maybe council might know?
30 seconds. He said 30 seconds.
Matt, the closed items, I think is it 2 closed items? Do we know how long that they're going to take?
At least a half hour, probably 45 minutes.
Not at all. It should be 10 minutes?
No, wait, we're talking the closed item, not this one.
The closed
Right.
The 2 closed items are going to be 10 minutes?
No, it's going to be about a half hour.
About a half hour.
So, right, so on the labor negotiations, that'll probably take 10, 15 minutes, and then it'll be at least 15 to 20 minutes on the second one.
I'd rather work through Mr. Chair.
As long as Angie's not here, okay.
Okay, so we're good with working through? Okay, all right.
I know, we haven't been agreeing.
In fact, Allison is here on the
Yeah,
labor one, so
You'll get
the
outvoted
sooner the
this
better.
time.
I know. She's not
Whether
there.
she's here or not, you're going to get outvoted. Okay, so let's move on to item 14, our only regular agenda item. We're saying. Yep. Okay. Georgia, if you're ready. Are you ready, or do you need, oh, here he is.
No, I'm fine. We present to you today, I think I'm the elected spokesperson here, but what you have today, and, oh, Barbara's ditched me. At any rate, is the Board of Supervisors' responses to the grand jury report, and there are 3 different items. So this package is a little confusing. What you have in the front is a cover letter to Judge Saunders, and obviously that's one of the recommendations is to, number 1, approve the content of these responses as your response, and then authorize the chair to sign this letter so that we can transmit those to the presiding judge. So the first response is with respect to the recruitment and appointment of the county administrative officer by the Board of Supervisors, and we've listed that as your response, but also that response from the county administrative officer, county council, and human resources. With respect to the sheriff and probation, they submit their reports directly to the presiding judge independently. However, in looking at their recommendations, what we've tried to do is kind of respond then from the board, because you were responsible for responding as well. So there's 3 different sets of responses here for 3 different items, and then we also attached for your information the chief probation officer's response from him, as well as the sheriff's response that he sent directly to the grand jury. So that's what you have here, and I'm certainly happy to answer questions if there are issues or you wish to comment, change, whatever these recommended reports.
Okay. Are there any comments or questions of the board?
I just want to thank staff for going through the process, because I know that it is a lengthy process, and I agree with responses that are on the report, and so thank you to you and to staff. Thank you, Mr. Chair.
Would anybody from the public like to address the board on this item? Seeing none, what's the pledge of the board?
Move to accept the responses by staff to a grand jury.
Second?
I have a motion and a second. All those in favor?
Aye.
Those opposed? Passes 5-0. Okay. With that, we will adjourn into closed session.
Yes,
County
thank you,
Council?
Mr. Chair.
Did you need to add Darren and Ted on?
I will. When I report it. Thank you, Mr. Chair. The Board of Supervisors will now meet in closed session to discuss agenda items number 15 and 16 on today's agenda. As previously reported, agenda item number 17 has been continued. Agenda item number 15 is to meet in closed session and confer with the county's labor negotiators. The agency designated representatives are Allison Hauk, Ray Espinoza, Joe Paul Gonzalez, Melinda Casillas, Georgia Cochran, and we'll be adding to that list Darren Thompson, the San Benito County Sheriff, and Ted Baran, who is the Chief Probation Officer. The employee organizations involved are institutions, associations, law enforcement management, management employees group, SEIU Local 521, the general unit employees, Deputy Sheriff's Association, SEIU United Long-Term Care Workers Local 6434. The authority can be found for this closed session in California Government Code Section 54957.6. In regards to agenda number 16, the board will meet and confer with legal counsel regarding anticipated litigation and the significant exposure to litigation pursuant to subdivision D2 of Government Code Section 54956.9 in one case. Thank you, Mr. Chairman.
Okay, would anybody from the public like to address the board before we adjourn?
I would like to make a comment on the closed session, please, and the specific one is whatever number it is concerning labor negotiations. While you are doing your net labor negotiations and talking to the unions, I hope that the members of the board and the members of the workforce think of how much better off we would be if we had that $1 million a year from the PV2 solar energy agreement that we don't have because of the CEQA lawsuits brought by members of this community. Thank you very much.
Okay, with that, we will adjourn into closed session.